Hello, good morning. Welcome to my student support system. In today's class, we will discuss about first aid. This lecture is in English. If you want to see the same lecture in Hindi, you can visit my channel and you can subscribe so that you can get notification for upcoming videos. What is first aid? Let us start from definition. First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. It includes initial intervention in a serious condition prior to professional medical help being available, such as performing cardiopulmonary resuscitation while waiting for an ambulance, as well as the complete treatment of minor conditions, such as applying a simple plaster to a cut. First aid is generally performed by someone with basic medical training. What is the history of first aid? History of first aid involved warfare, men injured in battle, and the lack of medical attention usually resulted in loss of life. In the year 1099, religious knights trained in medical care organized the Order of St. John's to specifically treat battlefield injuries. In other words, although these knights were considered laypersons, they were formally trained to provide first aid. They were first aiders. It means the history starts from 1000 years. In 1773, physician William House began publicizing the power of artificial respiration as means of resuscitation of those who appeared drowned. This led to the formation in 1974 of the Society for Recovery of Persons Apparently Drowned. Napoleon surgeon Baron Dominique Jean Larrey created an ambulance corps, the ambulance volontaires, which included medical assistants tasked to administer first aid in battle. In 1859, Jean Henry Dunant witnessed the aftermath of the Battle of Solferino, and his work led to the formation of Red Cross with a key stated aim of aid to sick and wounded soldiers in the field. The Red Cross and Red Crescent are still the largest providers of first aid worldwide. In 1870, Persian military surgeon Frederick von Eschmark introduced formalized first aid to the military, including training of soldiers in Franco-Persian War on care for wounded comrades using pre-learned bandaging and splinting skills. In 1872, the Orders of St. John's of Jerusalem in England changed its focus from hospice care and set out to start a system of practical medical help, starting with making a grant towards the establishment of UK's first ambulance service. This was followed by creating the St. John's Ambulance Association in 1877 to train men and women for the benefit of sick and wounded as first aiders. So this is the history of first aid. Now we come to symbol of first aid. What is the symbol? Here you can see internationally accepted symbol for first aid is white cross on a green background shown below. This is symbol for first aid. Many times you must have seen red cross on the first aid boxes. So actually this is used everywhere because Red Cross Society is a leading first aider and trainer for the first aid, but actually this is the symbol of Red Cross, and for first aid we can use this symbol. Objectives of first aid. What are the main objectives? During first aid, our prime objective is preservation of life, promotion of recovery, prevention of further injury, transportation of victim to the hospital as early as possible, relieving pain and discomfort, protection of the unconsciousness, and prevention of excessive blood loss. So with these objectives, we provide first aid. And while providing first aid, we should keep in our mind some principles. What are those? That quick response to the emergency, we should not delay. Safe response to the emergencies for the benefit of casualty, bystanders and rescuers. All should be safe. Securing the emergency site to reduce further harm to the casualty. Using appropriate first aid procedure and techniques. Safely moving the casualty, minimizing pain and helping stabilize the condition. Providing reassurance and guidance to the casualty, communication with bystanders and emergency service personnel, transportation of client to medical facility as early as possible, clearing the crowd around to assure fresh air to the victim, and providing comfort and alleviating pain. Now, what is first aid box? I am sure that every one of you must have prepared a first aid box during your training or even for the use at home. So whenever you prepare first aid box, you should know what is it. We should keep a first aid box at every place to be used for emergencies at home, at school, at factories, at workplace, or means of transportation like buses and trains. First aid box is a plastic or metal box containing some items in it. So ideal first aid box should contain plasters in a variety of different sizes and shapes, small, medium and large sterile gauze dressing, cotton roll, at least two sterile eye dressing, two triangular bandages, roller bandages 2 inch, 4 inch and 6 inch, crepe bandage, safety pins, disposable sterile gloves, tweezers, scissors, alcohol-free cleansing wipes or alcohol cleansing wipes you can take, sticky tapes, thermometer, digital, cream and spray to relieve pain, antiseptic cream, painkillers such as paracetamol or brufen, antihistamine cream or tablets, distilled water for cleaning wounds or normal saline, eye wash and eye bath solutions, measuring cup or ounce glass. So by these steps you can prepare a good first aid box. Thank you students for providing first aid or learning first aid in special situations. You can continue to watch my channel. We will discuss those points in further lectures. Thank you.